Thank you again, everyone, for joining us this morning. My name is Miranda Stiers, and I am the Capacity Building Program Specialist here with the California Partnership to End Domestic Violence. As you know, this is our webinar for getting creative during COVID-19 and the importance of self-care and community care. I want to go ahead and give just a brief intro for our presenter today, Amanda Gibson. She is a licensed clinical social worker and an independent professional counselor with 15 years of experience. She treats adults and families in the areas of child welfare, domestic violence, trauma, chronic health, and mental health and wellness. She's a founder and CEO of Counseling CoLab in Sacramento, California. Counseling CoLab provides a collaborative space where therapists of all different backgrounds come together to serve the Sacramento area. While earning her master's in social work at USC, Amanda served as the program director at Good Shepherd Shelter in Los Angeles from 2003 to 2006. And in January of 2014, she returned to serve at the shelter as the director of clinical programs and operations after working in Sacramento in mental health. Amanda is also an adjunct associate professor at USC School of Social Work who teaches online classes to MSW students on the topic of intimate partner violence, domestic violence, and global violence against women. In addition to her extensive clinical skills, Amanda has always integrated self-care into each agency she has been a part of, and as a result has led several successful teams who provide high-quality, efficient services with low rates of burnout and staff turnover. So thank you, Amanda. I want to go ahead and turn it over to you now.
Thank you so much. I'm so happy to be here with you all today. I really miss working in direct service in the shelter world, but I do have several clients that I see in my counseling practice who are survivors of intimate partner violence or currently struggling with that. So I know the work that we do right now is really impacted by COVID-19. And I think one of the ways we'll start with this is just to really name and identify all of the context around what it's like to serve a community of people when you're going through the same crisis with them. And then we'll move on and talk a little bit about this idea of self-care and community care and how we can support one another. And then we'll talk about Polyvagal Theory and go into more detail of what that actually means, but really to find an empowering way for you to notice what's going on in your nervous system so that you can both for yourself regulate your nervous system so you can be more connected with those that you're serving and maybe even teach some of your clients that you're working with. So we'll go ahead and get started. I'm just gonna get you guys. Okay, so let's see. I want to get my slides up here. Okay. All right, so first off, let's name this. It's collective trauma. Literally, the definition is cataclysmic event that shatters the basic fabric of society. Aside from all the horrific loss, it's also a crisis of meaning. So like, oh, that's what this is. We're all going through this. It's that feeling of the heaviness in the air and that general discomfort that we might be feeling. And it's also grief. I really have been working with people a lot around grieving what they've lost, understanding what the uncomfortable feeling is. And this is really a strange form of what feels like right now as we're in the second month of this unrelenting uncertainty, which is where anxiety comes from. And so usually when we have anticipatory grief, like when someone's diagnosed with a medical diagnosis of a loved one, we will start to grieve the person that we knew. So we're already grieving life of what we knew before, and now we're trying to figure out what is this uncertainty going to look like. So I'm noticing, is there an issue?
Yeah, I was just going to tell you, we're not seeing your slides yet.
Oh my goodness. Okay, let's fix that. Okay, so we had them up when we were testing it out.
Yeah, so if you click share screen, which is the green arrow at the bottom.
All right, okay. Better.
Perfect,
Thank you. That helps, right? Okay, So we went over collective trauma, and then I was just talking about the uncertainty with anticipatory grief. And next, I want to acknowledge, because you guys are in the business of helping people who are recovering from the trauma of intimate partner violence. And as a mental health professional, I'm always looking at the symptoms of what people are experiencing. And so when you look at all of these definitions, and really my theory is that all of this is going on at the same time, because this is a new trauma for people. So we're in that acute stress disorder, which is usually the symptoms are there within the first month after being exposed to something. And this is, again, turning into it more of a long-term chronic trauma, not just a month. And then we have PTSD, which to meet that criteria, you have to have symptoms for at least 6 months after the trauma. And then CPTSD, complex post-traumatic stress disorder, results from the repeated trauma over months and years rather than a single event. When we do research about complex trauma, they actually will talk a lot about survivors of domestic violence, because they often have complex trauma. They could have had childhood trauma, and then the relationship trauma, and maybe other losses in their lives, or issues with facing life or death situations. And then all of you hopefully are familiar with vicarious trauma, because being in this field, if we don't have our own trauma history, which I know many of us do, we can end up having vicarious trauma, where we're actually having the symptoms of PTSD because we're working with trauma survivors. So that's a lot right there that we're all contending with. And I think we really have to look at all the service delivery in our systems and how we're taking care of ourselves through this trauma lens to really make sure that we are being responsive to those mental health needs. And hopefully others of you are also embracing trauma-informed care in your agencies. And it's really easy to throw out the framework that you might have been working from when you're in a new crisis. But I think trauma-informed care is even more important right now. And you can see on this little graphic that it's really the staff, the agency, and the community all coming together to support the clients in the middle. And I want to encourage you to continue to think about the work that you're doing and these sometimes very quick decisions that you're having to make about changing rules and protocols. I was putting myself in the shoes of you who might be running shelters, and I have literally woken up at night thinking about where I used to work at Good Shepherd, about how are they handling social distancing, and are they going to the playground, and what is happening. So as you guys make those changes, really think about that trauma-informed care lens. So this next slides went around on social media a few months ago. I don't know if any of you saw them, but I really thought it was a great representation of what we're really talking about when we talk about self-care. So there's different types, the self-soothing things, which are really some that we're missing a lot right now. I don't know about you guys, but my self-care plan was always to go out and get personal services to feel better. And I can't do those things now. So I'm having to figure out what can I do that's still self-care, that's in my own house. But you can see on here, there's still many things that you can do. Cuddling might be difficult at this time, but you can still cuddle with your pets and your loved ones in your own household. And touch is so important. And we're really missing a lot of that right now. And then self-care are the activities that really have a little bit deeper meaning and foster growth and groundedness. These are more of the basic things we know, especially when you even look at our Surgeon General, who's coming out about more information about ACEs and how we should be getting through COVID. It's back to sleep hygiene, exercise, nutrition, all of those basic things are maybe even more important. And I think this is a great time to get therapy if you're not already in therapy. All of us are doing therapy online. There are a lot of resources out there to reach people for their mental health right now. So if it's something you haven't done, I want to encourage you to try that out while your maybe pace of life is a little slower. And then when you look at community care, and this is why I really like this model for the work of domestic violence programs, because you guys really do a lot of these systems within the shelter programs and encourage it as people leave shelters as well to find ways to connect and help the families that you're serving, find things like childcare collectives, sharing skills in mutual aid. People are getting really creative with that. And a shelter in and of itself is really co-housing. So you guys have that system down there. One of the things, though, I will say that's coming up for people who are still in direct service and essential workers is that we're working really hard to make sure our clients have all of these things, but we're in positions now where we may need these also. So I want you to also think about what's going on in your community and get involved so that you have some of these extra supports that you're so good at getting your clients connected to. And then this structural care, this is more of the macro level things that we're really seeing. We're seeing things like the stimulus coming through and kind of being like universal basic income or a living wage. We're seeing really creative things coming up with elder care and child care right now, trying to keep child care going for essential workers, and then having food delivery services for elders and really supporting them through this. And then we're also seeing some of the shining more of a light on the disparities, especially when we look at the social determinants of health during this crisis. So we're really seeing what systems are benefiting in terms of being more innovative, and then we're also seeing where a lot of the inequalities are. So when we put this all together, we're really saying that you can't just feel better by doing self-soothing or self-care. You really need to look at your community and the systems that are in place as well. Because I think what was happening in the movement of trauma-informed care and self-care is that we were kind of screaming at people, just do self-care, just go take a walk, just take a bath, you'll feel fine. But if you don't have the other things in place to support someone's life, it makes it more and more difficult. And it can actually bring up some resentment from people who may not have all of the supports in place to actively engage in self-care. The other thing I want to name too about what we're going through is what's called a moral injury. And that's really when we may work within systems where we might feel like it's failing, or we're bearing witness to situations where our clients are being harmed because of the system, quote unquote. It's the system level burnout. It's usually felt at all levels of an organization with staff and even higher ups. And it's all the stuff outside of our control. We're definitely seeing that in our healthcare system. I work with several nurses, and their anger is really at, the hospital not having the PPE. And then their anger goes up a level to the county health department, to the state, to the federal government, that really they've been working in a broken system. And I think as domestic violence advocates, we can very much relate to this. And then when things start to change and all of a sudden it's like, we're going to get all of the homeless people off the streets by opening up hotels, people who have been in domestic violence or homeless advocacy are like, we could have been doing this for a long time. Like, where's all this money been? We've been saying we need these things to change the system, and now all of a sudden they are. And then there's a lot of concern about how those are all being implemented. But that's just an example of naming sometimes that rub that you might feel either within your organization or in the widely held macro level policies. There really can be that moral injury there. So when we look at stages of grief and loss, also, David Kessler, who worked with Elizabeth Kubler-Ross and who did the stages of death and dying, they have the stages of grief and loss, and they've added a sixth stage, which is to find meaning. And that is really, really important. And with the stages, I want to remind you that these are not linear. They tend to go in waves. You can feel multiple of these at the same time. You can circle back around to them when you feel like you've kind of moved through to the next one. So just looking at this and thinking about where you were at the beginning of March, just for a second, and you were starting to hear the news. I know for me, I was in denial. I thought, this isn't really happening. Why are we making such a big deal out of it? And then I can remember sitting there, I think it was on St. Patrick's Day, or a couple days before that, when they were announcing that the NBA was getting shut down and all this social distancing was starting and all these new terms, I was so filled with anger of like, well, we did know about this, and why the heck weren't we talking about it? And then I think with bargaining, we're seeing that a little bit in the beginning of like, well, I can get through this if it's 2 weeks. I can get through this if it's a month. My agency, those of you that are in leadership, we have enough money to get through a certain amount of time. And then when you're seeing right now, people are really bargaining because they're getting very stir crazy, cabin fever, and starting to make their own adjustments to the public health orders to try to meet needs like exercising outside, going to the beach. And then those of us who are on the front lines can go back to anger, like, why aren't people following these things? We really, need everyone to follow this because we're on that front line. And then sadness, that's where I think the grief is there, the sadness of what's going on, missing our family that we can't see, missing touch, missing coworkers. So some of you that might be working remotely, you might end up, feeling like you're really missing your coworkers. So this idea of meaning, I really want to think about this now for just a second before we move on to talk about what we can do to get through this time. So Viktor Frankl, Holocaust survival, founder of existentialism, he has this quote: in the space between suffering and finding meaning, you can begin to visualize being halfway through a crisis. You can start to ask yourself, what meaning am I finding? So I want you guys just to take a second and either jot down on a piece of paper in front of you or put it in the chat box if you're comfortable. Put it in your notes in your phone. What meaning are you finding going through this? How do you want to be changed by this experience? Just write down a couple things. Take a minute or so to do that. Jen says, I'm able to spend more time with my family and realize that I do not have to be busy all the time. I so resonate with that, Jen. And I think the busy all the time can be such a form of over functioning that we may not even know we were doing just to keep things going. I've realized how much I'm doing that too, is fighting that need to feel busy. And as the weeks have gone on, I've been more accepting of not having to be so busy. And I'm glad you're getting more time with your family. That's awesome. It's a great example. Well, hopefully you can, put that sticky note where you can see it or put it on your phone, because the meaning making and the meaning finding is really key to continuing to find resiliency and hope as we go through this. So let's talk about polyvagal theory now. Many of you, again, very well-versed in trauma responses. You live with trauma, you're might have had your own experiences, you work with trauma survivors. And we usually just think of PTSD as flight, fight, or freeze. We kind of know what that looks like with clients. And we usually are just trying to, fix it or avoid having to really deal with the actual behaviors that are there with trauma. But this newer theory, it's not really that new of a theory. It's new to me, and it's been really life-changing to really feel more empowered and thankful and grateful for the way my body works. And that even some of these trauma responses of fight, flight, or freeze are really there to protect ourselves. They were there as we were developing as human beings, when there was the actual bear or tiger chasing us in a forest so that we could get safe. But we know from epigenetics and our own experiences with trauma in our families, some of this gets passed down, and these responses that are going on physiologically in our bodies are very real. And if we can understand what they are, we can learn that we can get into this third nervous system response, which is our social engagement system, a playful mixture of activation and calming that operates out of a unique nerve influence. And this is really important. We're going to talk about how do we access that part of our nervous system, because when we shut down the vagal nerve system, that's when we can move into immobility or disassociation. On this slide, we have a little bit more breakdown on the different parts of our nervous system. So on the left, you have the green color, which shows the nerves that come from our brainstem, where we're in ventral vagal, which is the social engagement network. It's all the nerves in our face, throat, and chest. It's what enables us to talk, engage, co-regulate, which we'll talk about later in the presentation, where with another human being, we can feel safe. And then how we self-soothe, stay calm. And it's also at the top of the regulatory and evolutionary ladder, because all of this has happened over time and how we've evolved. Then in our sympathetic, this is where all of the nerves you can see in the red on the diagram are coming out from your spinal cord. And this is what mobilizes you into running away from danger, where you'll see the increased heart rate, tense muscles, and fast, shallow breathing. It's in the middle of that evolutionary ladder. And then your dorsal vagal is when you freeze, collapse, disassociate, and mobilize. A lot of victims of domestic violence and sexual assault are very familiar with the freeze response, because they'll often say, why didn't I fight back? Why didn't I get up and move or whatever? But really the body shuts down. You can see different animals that may play dead in order to stay safe, and then they end up being okay after they go into that immobilization state. So this is all in the diaphragm, the heart, and the gut area. We always talk about feeling things in our gut or our intuition. And you think about where all these nerves are. If that gets shut down, that can also influence maybe poor what we would label and pathologize as poor decision making. If you're shut down and immobilized, you can't access the prefrontal cortex to make a safe choice or a safe decision. And so we also can see in this dorsal vagal decreased heart rate, low energy, depression, numbness, and just shutting down altogether. And that's in the blue, which is, you can see where the nerves are that go into your gut and your diaphragm. The other interesting thing too is that we'll do an exercise in a moment with deep breathing. And we talk about the deep belly breaths and needing to breathe past your diaphragm. If you are in sympathetic and flight or fight, your muscles can get so tight that it's hard to even breathe into your diaphragm, especially the psoas muscle, which is the muscle that connects your hips to your legs. They call that the fight or flight muscle, where you would actually need to be able to run if you need to get away. But if that is tight, it's hard to breathe that deeply. So we're going to work on getting in touch with the deep diaphragmatic breathing. So I've talked about a couple of things that I want to just clarify with terms. Sympathetic is the flight, fight, or freeze. Parasympathetic is the calm part of your nervous system that tells your body that it's okay to rest and digest, as we call it. So those are the moments where, like, those of you that do yoga and you're in Shavasana, where you feel really slow and restful and calm. There might be a person that you connect with that you feel really safe with, that you feel like it's just evolutionarily safe to actually sleep and eat food and digest your food. And then the vagus nerve, this is where we've really evolved. And when you think about the nerves that are related to this nerve, where they're in your face and your voice, it makes a lot of sense when it comes to attachment and communication, and where we get that early in with our parental or caregiver system. And you are familiar with the still face experiment, where the baby is trying to get the mother's attention and they intentionally tell the mom to have a flat affect. And the baby gets really distressed by that because they're searching for that feedback, that nonverbal feedback in your facial expressions. Also, why, like a lot of the kids that we work with in the domestic violence shelters will sort of have physiological responses to loud, scary sounding voices. It goes into that part of the ear and signals danger. So these are also really good things to go over with, I think, the parents we work with in terms of teaching them to keep that calm voice and help regulate their child. So I love this slide. And I think this really applies to when we are working with clients, that if we're regulated, we're able to think more clearly. And then we're able to show and say to clients, you're safe, I'm here with you, and we can find a solution. So a lot of our clients stay in that survival state, in that deep part of the brainstem, and have a really hard time ever feeling safe. And sometimes we just have to work there at that base level to constantly talk about the feeling of safety. And then once that's established, and I can remember seeing this when I worked in the program, after a few weeks of being there, then people were able to connect better and start to trust staff. So how do you know when your nervous system is even changing? This is where a lot of the work is, especially those of us that go on autopilot and just stay busy. Even mental health professionals, we can get really checked out of what our body's actually feeling. But if you can notice subtle changes in your own body language, eye gaze, muscle twitching, or breathing changes, then you can go, oh, something's happening. I'm getting a warning here. Something feels unsafe, or I feel like I'm checking out and I'm overwhelmed. And you can kind of notice which thing is happening in your body. You can also, through additional training, be able to identify when this is happening with clients you're working with. So I can remember so often that, like, going over, how to navigate like a social service with one of the moms at the shelter, and we would go over like the directions of how to get to the bus and all of that, and then she would get lost and she couldn't make it. It would be so frustrating. Well, then we find out that there was someone on the bus that looked like her abuser. So really difficult to get through that without doing the mindfulness techniques and the breathing. But I can remember feeling very frustrated sometimes with my clients because I didn't understand what was going on in their physiological system. So when you're in hyperarousal, which is fight or flight, here's some of the symptoms on that. So I think my slides are on like a timer and it's going faster than I am. So anxiety, feeling overwhelmed, chaotic responses, just kind of feeling like you're all over the place, feeling really emotional and angry and having outbursts, being more impulsive, feeling panicked, having racing thoughts. All of these things can be that hyperarousal when you're in fight or flight. You might not actually be running away, although you might fantasize that you want to run away from a situation you're stressed out by. And you may not be actually getting into a fight with anyone, but this is what could be being created in your nervous system when you're in fight or flight. Hypoarousal is the freeze or avoidance response. So this is when we see things like disassociation and disconnection. This is where you can see clients are just checked out, or this might happen to you when you're in a meeting and you're overwhelmed. This is that feeling of being on autopilot and going through things. I think a lot of us have been in this a little bit, getting through the initial stages of COVID-19 and making changes. I know I have felt that way just to deal with the crisis of being an autopilot. Shame can also be really present with this response. And, this comes up for me where I'll question a lot of what I'm saying or doing in an interaction afterwards. And I'll go into a shame spiral. Did I say the right things? And it's like, of course you did, but it's this activation of that hypoarousal, feeling like you can't think. Decision making is really difficult, analysis paralysis, overthinking things, and then feeling really separate from yourself, kind of depersonalized, not really even knowing how you're feeling. That can be a sign of hypoarousal, and emotional numbness. So what we want to find is this window of tolerance where you are able to stay connected to feelings and self, and able to emotionally regulate and self-soothe. And you can go between the nervous system states with ease. And you can notice, I'm hyper aroused, I'm hypo aroused. You don't judge it. You don't think, oh my gosh, I thought I was over this trauma. Why am I triggered again? You just notice it's happening and you choose a strategy to go into this ease between the states of the nervous system. And when we're in parasympathetic, we're safe and we can connect with others. That's where healing from trauma happens. Trauma often happens in relationships, but it gets healed in relationships. So you think about the huge impact you guys have on your clients of having those safe relationships that often are lifelong lasting relationships with domestic violence programs. I can remember interacting with a child that I had in the shelter the first time I worked there, and she was a young adult when she came back, and she said, this is one of the places that I feel safe in the world, just coming back to visit us. And that's really what's so amazing about the work that we all do. So techniques for down-regulating a hyper-aroused nervous system. So you've probably heard a little bit about grounding techniques. When you're choosing or encouraging a client to choose a strategy, you always need to give choice and have options. Oftentimes we will think that someone needs to just sit in a room and stay still, and that can feel very controlling. Sometimes it can mimic the feeling of being stuck in the room with the batterer, like if you're having to have a tough conversation with a client. And it's okay to let people get up and move around in a room. And even just the act of going to the door can tell their nervous system that you're getting like a satisfaction of that movement of the flight part without actually having to leave. Although sometimes you might need to let someone just go take a walk or move even more. I do a lot of walk and talk therapy because sometimes it's easier for people to talk when they're moving. And really, sometimes people need to move a little bit when they're in hyper arousal before they can do a breathing grounding technique. So you want to check for that for yourself and with your clients to give that as an option. But we're going to do a grounding technique if you guys would engage with me a little bit here just from where you're at. So we're going to just quickly do a grounding exercise, and then the other techniques will build on this. Okay, so if you can feel your feet and your seat, as we say. So we're going to really pay attention to what your feet are doing right now and where you're sitting and the feeling of that. So if you can just focus on your feet for a moment and just notice them. I want to invite you to put your feet flat on the ground and not be cross-legged or cross-kneed. Actually having your feet connected to the earth is really key to this, but you can do it with shoes and socks on. And you're going to want to just feel each of your toes, and you can just push down each toe into your sock or your shoe, and then feel your shoe or your feet touching the floor, and notice the chair touching your back, touching your bottom, and just feel the support of that. Then I'm going to invite you to do what's called a 4-count breath with me. We'll do 3 breath cycles on this one. And I want you just to be continually noticing your feet and your seat so that you're really staying grounded as we breathe. Because sometimes when we start to breathe, it can be a little overwhelming. So I'm going to demonstrate it. I'm going to inhale and with a count and then exhale. So I'm going to inhale for 4 and hold for 7 and exhale through the mouth for 8. The long exhalation is what's getting into your dorsal vagal nerve, getting past your diaphragm when you do the long exhalation. So we'll go ahead and do 2 more of these. Inhale, hold for 7, and exhale. Like you're breathing through a straw. Inhale for 4, hold for 7, exhale for 8. Just notice if anything shifted in your body. Just noticing, observing, no judgment. Notice your feet again. And another grounding exercise is to notice what's around you. So if you can just in your office or your room, wherever you are, notice something you can see. I can see a green plant. I can smell my essential oils. What's something you can smell where you are? Something you can touch. Something you can hear. And you realize wherever you are right now, you're safe in your body and you can return to this at any time. So what if you're hypo-aroused? What if you are checked out, feeling really low energy, feeling super sluggish? That might be something, or when it's actually starting to happen, it's always best to try tapping or rocking. Rocking, again, we're mimicking what caregivers do to infants. So you could just kind of rock in your seat a little bit, wake your body back up so you don't go into immobilization or freeze. Tapping, if you can tap your collarbones, that will also keep your body from going into immobilization. Those of you that are trained in CPR, we often will touch the collarbone to make sure someone, can they hear us, or they alert. So there's something, again, the nerves right there that will activate you. You can also do some tapping on your face or forehead so that you don't go into immobilization. You can also focus on an object. You can have like a rock or a crystal that you keep with you that you hold. And then anytime you can just press your toes into your shoes, into your feet. So co-regulation, this is where we do this with another person. Some of this is very strained for us right now with social distancing. But there are ways to co-regulate even virtually. But if you are in the same household, instead of just giving someone a quick hug, really holding them with full body contact for 60 seconds, that's comfortable for you and them. Cuddling is really, really good for this. You'll notice, those of you that have children, sometimes you can match your breathing patterns with them when you're cuddling. Very calming. And then if you have pets, when cats purr or a dog sighs, they're co-regulating with you. And that can feel really, really good. Virtual co-regulation. So FaceTime and even these Zoom calls, we are getting voice regulation and eye gaze. So that's really important that you take your conversations, even though some of us are getting a little burned out on FaceTime and Zoom. But when you can really look into someone's eyes, you're helping them to co-regulate. And then with kids and even adults, my niece and nephew have been, they kiss through the FaceTime, or they put their forehead on the camera, and they really feel like they're connecting with me, and it feels really good to my nervous system also. Other tips for self-soothing, if you are not able to do that with another human being, weighted blankets are really good for anxiety and will give you that sense of containment. Sandbag that we use maybe from yoga practices, you can make that at home with a tube sock and just putting sand into it, because you're getting something heavy and weighted to put on your body. Essential oils are really great for grounding and filling your environment with a sensory experience. Thinking putty, they sell that, you can get it on Amazon, where you can really put that anxious energy, especially if you're hyper aroused, into the putty and play with that. Sometimes I have clients play with putty when we're working together. Anything where you can swing or rock. If you have a swing, any kind of a swing at your house or a rocking chair, very self-soothing. Going for a drive, feeling the motion of the car. And then a lot of healing sounds and voices can also help. And there's a lot of free YouTube videos with healing sounds, and that will also help ground you. Really important to get support. If you don't already have it, this is the time to think about getting it. And those of you that are in a partnership or a roommate situation or live with a family member, You might need to get help from outside of that primary relationship because you're both probably getting depleted as we go through this. Talk about your feelings, name them, acknowledge them. And then this is the very tired analogy, but I think it still very much applies that we've got to put our own oxygen mask on first to avoid caregiving burnout and compassion fatigue. And then hopefully, I know a lot of my friends work in our field, but I have a couple who don't. And I'm noticing that I just want to talk to them about whatever they're watching on Netflix and not about COVID-19 and not about the heavy sessions I'm having with my clients. You need that lightheartedness. You need to come up out of the intensity of this work. And then self-care plan. So if you don't already have this written down, I do want you outside of here when we're done, because I want to be able to get to questions, to write out what your pre-COVID self-care plan was. And maybe it wasn't something you were super conscious about, but let's say you really like to get mani-pedis as your go-to thing, and you can't do that right now. Really write out all the things you were doing. Let yourself feel some of the loss that you don't get to do that, and figure out what you need to change in your self-care plan. Because that hyperactivity or staying busy all the time, what I've realized is that when I was seeking self-care by going and getting a service, it was keeping me in my hyper aroused nervous system because I was go, 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 busy, busy. Maybe when I got there, I relaxed a little bit. But now it's like, oh, wow, there's a whole lot of other internal things that I can do to get into that easy part of my calm and connected nervous system that doesn't have to do with an outside resource. It's more coming from within, I would say, for me right now. So as you apply what you learned today, think about those self-care activities and the examples that we gave, where you can really look at, what do I need to do when I'm hyper aroused and when I'm hypo aroused, so that your self-care plan, the activities are linked to what your nervous system is doing. And I am happy to meet with anybody outside of here if you kind of feel like, I don't even know what my body's doing, or I'm so checked out. You can learn these skills in a few sessions of just really being connected to what's happening in your body, because it's so much more effective when you can match the activity to the state you're in. And that's where we get resiliency. That's where we can keep doing this work and not get burned out or really, have a difficult struggle going through this pandemic. Okay, well, let's see. I think I talked enough. Got about 12 minutes left for questions and answers. And don't know if there's any in the chat box, or if you guys just want to, how we should do that. Miranda, do you want to facilitate the Q&A?
Sure, I can absolutely do that. So if folks would like to unmute themselves to ask your question, you are welcome to do so. If you feel more comfortable posting that in chat, we can absolutely read those questions out.
I have a question for you, Amanda, in regards to the essential oils, because I've been starting to hear a lot about that. Can you share how that works?
Sure. So like we talked about, the nerves that are in our face and chest are really what activate the social engagement system. So smelling things gives you an opportunity to be in that easy, calm, socially engaged state. There are essential oils that are developed to give different sensations. And if you go look online, one that I really like is doTERRA, and they have an oil called Grounded, and they have one called Balanced, and there's also one called Joy. And all three of those, what the components are, kind of match the different states of arousal. So if I have a client who's really hyper aroused, I'll give them the Grounded oils. And sometimes I just put them out in front and I'll ask them to smell and say, which one feels good to you today? And this is not scientific, it's completely anecdotal, but they usually choose what they're needing. They're either the uplift or the grounding. And it's pretty fascinating that their body kind of intuitively is drawn to that scent because of what they're needing in that moment.
Thank you so much. I hadn't even heard about that. So I just had been hearing essential oils a lot lately. So I was
Yeah. Thank you. Yes, and they have, I'm seeing Lacey's talking about the doTERRA oils. They do have diffusers and different devices to get the smell out in the in your environment. They also have an oil called On Guard, and they sell a hand sanitizer. Right now you can just buy one at a time because we're all practicing not hoarding things, but it's got this, it has the components of 70% alcohol so that you're actually getting the sanitation, but there's also scents in there that are protective to your immune system, like cinnamon. And then I've been diffusing that in the office, even though I'm just doing telehealth, just to feel this sense of protection when I'm here by myself.
We have a question. How do you teach your clients about trauma responses?
That's a great question. So I am a huge neuroscience nerd, and I do a lot of psychoeducation, and I have some handouts that I go over with them and some YouTube videos to watch so they can begin to know what the language is, and then most importantly, know what's going on in their nervous system when it's happening. And so when I'm doing the therapy, I'm often pointing out, wow, your shoulders are really tense today. Do you feel that they're really close up to your shoulder? Oh yeah, they kind of are. Okay, let's work with that. So it's like really watching the way the body's responding, and then the softening of the facial expressions that will happen when they really get involved in the social engagement system when they're in therapy. But I really give them a lot of psychoeducation, and then we work a lot on the self-care plans, and they begin to use the language of like, I was really activated with my child when I got home from work. I was so annoyed by the mess that was there and their high-pitched voice. So I went in my bedroom, or I went in the bathroom, and I did the 4-count breath for 3 cycles. And then I was able to go back and calmly engage my child. So a lot of psychoeducation.
Sorry, there's also a question in the chat. Would you please talk a little bit further about how to be okay with your feelings, even if they are negative? I.e., how can we be more accepting and less judgmental of the whole spectrum of our emotions, not just the positive ones?
I really like that question, because there can be this toxic positivity. I don't know if you guys have heard that before, where we tend to stay really cognitive and intellectualize and try to convince ourselves to get out of a feeling state that may be unpleasant. So when it comes to talking about feelings, I always tell people feelings are neutral. They're not bad or good. Because a lot of times, especially for women, we were socialized to think that anger is a negative thing, or it's unbecoming to be angry or express anger. But it's just, feelings are just neutral, and they just need to get up and out of us and move through us. I think another thing that's really important is sometimes when we may deal with a lot of codependent tendencies, we may be putting our own emotions last and doing everything we can to avoid dealing with the negativity from someone else. Or when we set a boundary, we have to go, okay, I chose myself, I set that boundary, and person over here I set that boundary with, and you may have a negative reaction, or you may have an intense feeling. That's okay. You will deal with that. That's not mine to take on. So neutralizing the emotions, but then also talking about them as a level of intensity or not. So you might feel a really high level of anger with a certain situation, and then maybe feel some shame afterwards, like, oh gosh, why did I just like snap at somebody, or what happened there? But it just means that you were feeling anger more intensely. You were high up on your distress tolerance, And maybe if you did some breathing or one of the techniques, you could have brought it down a couple notches, and then you could have been a little more engaged with the person in a way that wasn't so defeating to you or them. But I think that also in this question with the less judgment, I want to touch on that really quickly. One of the things that happens with grief and loss, you probably have heard the statistics, using a really sad example, but like when a couple loses a child to a sudden death, the divorce rate is very high. And why is that? Usually it's because they're grieving differently, but it's the fact that they're judging one another's coping skills and how they're grieving. And that's what dissolves the relationship. And right now, I think we're judging our own reactions to COVID-19 pretty harshly. And then there can be judgment towards other people in our life and our family who might be coping with it differently. You might have someone who's a really strong rule follower who's not leaving the house at all. And then you might have another family member that's, pushing all the boundaries and doing all the things they're not supposed to do. How do we not judge that? How do we just say, okay, I'm going to let you have that experience, and I'm going to stay over here and really decide what I'm feeling and what I need to do about it. So just to quickly summarize, feelings are neutral. We can deal with the intensity with the skills, and then we can work on non-judgment of others and ourselves by just setting boundaries and letting people have their feelings. And yes, Christy, I'm seeing your note about the oils. With any of these techniques with trauma survivors, we want to really get to know what happens in their nervous system. So that's why the psychoeducation is so important up front and finding an established language, because we always want to give trauma survivors choice. And so if there's an oil that they're getting a hyper-aroused or hypo-aroused response with, then we would want to notate that and not have that in there. Sometimes we might have an oil like just in a whole common area. That might be problematic because we may not know how that, this grounded oil that I use may not be a calming to someone who walks into my office. So I've got to be careful with that. That's why I usually give the choice when I'm in the room with them. But I'm glad you pointed that out.
All right. Are there any further questions that folks have?
And my contact information is on the last slide. And, I want to make myself available to you and your organizations, because we can do these kinds of webinars with, a group of staff. We can do the, kind of agency level consulting. We also offer coaching for interpersonal development and leadership, as well as online counseling. I see a lot of therapists who come to me for therapy, or other people in social services or healthcare. So feel free to reach out and we can work something out, because we're all in California and we're doing it all online. So feel free to reach out.
Thank you so much, Amanda. And I do want to ask folks to give just a moment to take a quick poll. I'm going to go ahead and launch that. So did this webinar contribute to my own or my organization's work with gaining an understanding and our skills? Thank you so much for getting a lot of really great responses. We'll give that just another moment. Thank you so much, everyone. And do appreciate everyone's participation. The slides will be made available to everyone after the presentation, and the webinar was recorded, so if folks are wanting a recording, then please feel free to reach out to us for that. And with that, I'm going to go ahead and close, and thank you everyone again so much for your participation, and Dr. Gibson for sharing all of your knowledge with us.
Thank you all very much. Take care.